Medical Center. Your host, Pat Pingatori, is the Director of Community Relations for the Sound Shore Medical Center and is also a registered nurse. Stay informed of the latest health and medical topics. Now on Health Talk.
Welcome to Health Talk. I'm your host, Pat Pingatori. According to the American Academy of Pediatric Dentistry, your child should visit the dentist by his or her first birthday. Here today to talk about children and dental care is board-certified pediatric dentist Dr. Herbert Smith. Dr. Smith has a large pediatric dental practice in Larchmont, New York. Dr. Smith, thank you so much for joining us today.
You're welcome.
Why don't you begin by telling us why parents should bring their child to the dentist in such an early age?
Well, I think it's important for the dentist to see the child so early because unfortunately, even at that very early age when children first get their very first teeth, some early problems can begin. And if a pediatric dentist does take a look at that age, can spot problems when they're just starting. Beyond that, I think it's a very worthwhile thing to spend the time at that point with parents talking about getting a good start with dental care for the child's lifetime. It's a time when parents have gotten over the very early parts of having a new baby in the house, and when those new teeth come in, that's a time when parents start to focus on them, so they're perceptive to that information.
So education is a very important part of the whole process of dentistry.
Yeah, it certainly is, particularly in pediatric dentistry.
Okay, now how should I care for my children's teeth? Do you have any recommendations or suggestions for us?
Sure. Even at that very early age, when the teeth first start to come in, it's important for the parent to start cleaning the teeth. And after all, the bacteria don't know the difference between our teeth and a little infant's teeth. And decay can begin even when those teeth first begin to come in. So it's important that the parent go in often with a little gauze pad over the finger or a washcloth over the finger. Or if they prefer, even a very tiny toothbrush with no toothpaste, and just go over the teeth, getting right down near the gum line and cleaning as much as they can.
I think that's something people don't really think about when their children get their first teeth or their baby teeth, that they really need to be cleaned, whether, as you said, with a gauze or a soft toothbrush.
Yeah, it's certainly true. Bacteria colonize the infant's mouth very early on, and cavities can begin even at a very early age.
Now, for such a small child, if you're cleaning their teeth, say, with a toothbrush, are you using any toothpaste?
No, it's usually best not to until the child gets a little older. When the child reaches the toddler stage, generally until those back molars come in, you can probably get away without using toothpaste at all. Then you can gradually introduce toothpaste, either some of the baby formulations, which have no fluoride at all, or as the child gets to be a little, if you don't floss all, just the ones where those teeth maintain contact with each other.
Even if you're not doing or need to do it, I think it's probably a good time to start developing habits anyway.
Oh, it is. And, nothing works better than setting a good example for your kids and flossing once a day yourself, because it's for most people, it takes 24 to 36 hours for the bacteria to reestablish themselves in large enough numbers to start causing mischief. So if you can floss and brush very thoroughly once a day, that's sufficient. Now, a second time during the day is all the better. And so I usually recommend to parents, at least do a quick job in the morning before you go out to school. It's usually a little hectic in most households, and it's not a good time to do a thorough job brushing. But before bed, that's the time to really spend the time. You can have toddlers start to brush their own teeth with your supervision in the bathroom. But when you brush your children's teeth, I think a very good way to do it is not to do it in the bathroom, although if that works for you, fine. But a good way is to bring the child out of the bathroom, perhaps before you read that bedtime story. Sit on the bed yourself, put a pillow on your lap, and have the child lie down with their head on the pillow right in front of you. It's in your position a little like a dentist does, looking into the patient's mouth. And then when you brush, use a dry brush. It's not necessary, or a little water, but you shouldn't use toothpaste. And when you go in there and brush, you can see what you're doing much better. You can get to all the back corners. Brush 2 or 3 teeth at a time. Give your child a rest. And you can floss that way, too, either using just conventional floss between your fingers or these little floss holders that are in little plastic applicators. A lot of them come in animal shapes, and a lot of parents like those. It's a little easier to get in there with those.
Now, you mentioned before a soft toothbrush. What is the reason for that?
A hard toothbrush cleans really well. It'll remove the bacteria nicely, but after many years of using a stiff toothbrush, you actually can cause some recession of your gums and start to expose the roots of the teeth. Now, that's not common in young children, but in teenagers we see it. Kids are over-aggressive in their brushing.
Now, with young children, how often should you bring them to the dentist?
I think it's real important for the dentist to see the child twice a year. Now, it's true sometimes with kids that have excellent oral hygiene, you've seen them for a few years, you have a history, no decay rate at all, then sometimes the dentist will recommend a once-a-year checkup. But typically twice a year is important, not only to check for decay and those sorts of problems, but also to monitor the growth and the development of the child so you can catch possible orthodontic problems early.
Let's talk about the relationship of proper feeding techniques and also how that impacts on the teeth.
Sure. That ties right in with your earlier question about why bring a child to the dentist so early. Unfortunately, there are, it's an old-fashioned practice, but some parents still continue to do this, and that is to let the child nurse right before bed, bottle, drift off to bed to sleep with that bottle in their mouth. Now, water will not cause problems, but milk, juice, even diluted milk or juice can cause severe cavities to the teeth, even in an infant.
Now, we do see, you did bring some graphics with you, and I know this is from the American Dental Association.
They were kind enough to let us reproduce these. I want to thank them.
Okay, and why don't you tell us what we first have up here?
This is a young child with a beautiful, healthy dentition. You can see there's nice spaces. This lucky parent does not have to floss, but this parent's been doing a nice job cleaning. There's no staining, there's no tartar or any other deposits right down near the gum line. I assume there's no decay.
And we'll move on to the next one, I believe, because we're going to be looking at some problems.
When parents let the child sleep with a bottle, this is usually the genesis of the first bit of decay. Now, it can come from even eating too many sweets at a young age, but obviously a very young baby is not going to be eating lots of candy. But it's pretty apparent between those two upper central teeth that decay is there. Now, you can see it, but boy, the destruction is much larger than what you can see there. Baby teeth are tiny, the enamel is thin, and even what appears to be on that picture maybe a small or medium-sized cavity is in fact a very large cavity. And I can tell you that decay is probably coming very close to reaching the nerve of that tooth already.
Oh, okay. Okay, and I do believe we have, okay, here's another.
Now, this is a child that's, I mean, any parent can spot this decay. Well, 4 of those upper incisors have very significant decay. For sure, the decay has reached the nerve, and it's going to be extensive treatment. Now, people say, well, gee, they're baby teeth. Why do we even have to fix them? Well, this child's probably 3 or 4 years old. Those 2 upper central teeth won't be lost until the child is 7. The next 2 over typically until about 8 years old. This child will be without teeth for 4 or 5 years or more if all it's done is remove them. Leaving them alone, that child's going to pretty certainly get pain soon.
And obviously this is a severe decay.
And this is severe. And this is what we see when we see children that use that nursing bottle at night. Or it can be even a child that's nursed by the mother, breastfeeding, where the baby's brought into bed, and ad libitum, all through the night, that child can nurse at their own discretion.
So that's kind of a continuous nursing.
Exactly, and that's the issue. If a child takes a bottle before bed, the teeth are clean, fine, but if that milk or juice sits on the teeth all night long, it has a chance to cause this kind of decay. That, unfortunately, is probably a trip to the operating room. That child probably has decay in almost every tooth in their mouth, and it's significant treatment, extractions, root canal treatments, anything you can imagine.
Now you mentioned the bottle, you mentioned feeding. What about the little sippy cups that children use?
They're okay if they're used the way you would use a regular cup and used as a transition to a regular cup. But I know we've all seen kids walk around the grocery store with that sippy cup in their mouth, and it can have the same effect. It's a constant bath of sugar water on the teeth, and it can lead to significant decay.
Now, we did see examples of decay, and tell us exactly what causes tooth decay.
Well, you need a few things. You need a tooth, certainly. You need bacteria. If the teeth are cleaned of that bacteria, you won't get decay. You need a source of nutrition for the bacteria, and that is the simple sugars. That's why dentists are forever harping on sugars. Proteins, if you eat a steak, doesn't help that oral bacteria make decay. They can only use simple sugars. There's a little caveat to that, and that is that starches can be used if they stay in the mouth a long time. So if you eat a pretzel, well, people think, yeah, that's generally better than a candy bar. But if a young child eats pretzels and it's not cleaned away, the starch stays on the teeth, and the saliva, with enough time, some of the enzymes in the saliva, the digestive ability of it starts to digest those starches, if you will, break them down into simple sugars, and then the bacteria use those simple sugars to make decay in the teeth. And gum disease as we get older. That's an important consideration in older teens and most of us as we get into our 20s and 30s.
So as you said before, if you brush and floss your teeth twice a day, that's that time factor, and you're limiting the amount of the bacteria or the sugars and starches around the teeth.
Exactly. And that should also influence parents when they decide on snacks. Well, if you want to give your child a sweet, sure. I mean, we don't want to make it the forbidden fruit. But on the other hand, teach your kids that sweets are not snack food, despite the commercials. They are not snack foods. They are a treat, and you have a treat for dessert, and you brush your teeth after you have a treat. It's not a through the day, after school, cookies and milk. Not a good idea.
Okay. Thank you, Dr. Smith. We're going to take a short break, and when we come back, Dr. Smith will demonstrate the proper brushing technique for children. Welcome back to Health Talk. I'm your host, Pat Pingatori, and with me today to talk about children and dental care is board-certified pediatric dentist Dr. Herbert Smith. Dr. Smith, very interesting first half of the show. I did mention you're a pediatric dentist. Why don't you tell us the difference between a pediatric dentist and a family dentist?
Sure. Well, after the 4 years of dental school that we all do, a pediatric dentist goes on for 2 years of additional training in a residency program. And in those programs, we learn psychology of children, special issues of growth and development, and a whole host of issues that specifically relate to infants, children, adolescents, and children and young adults with special needs also.
I did visit your office, and I know that it's a very child-friendly office. Why don't you tell our viewers a little bit about what you do to make the experience for children, you know, just a simple experience and a comfortable experience?
Okay. Well, one of the first things we do is we suggest to parents that at home to talk about coming a little bit, but not make it into such a drum roll and a parade. It's fine to check out a book at the library, great. But, you know, treat it like any other normal first experience. Going to the grocery store, to the bank, you can overdo a good thing. When we bring the children to the office, we try to have, in our office and most pediatric offices, we try to have all the instruments, all the gadgets, all the gizmos, everything put away. It's in drawers, behind closets, and so on, so that there are only a few little simple things out in view of the child. I like to start with having the child sit on the parent's lap while we review the medical history, separate from the dental chair. And then I like to gradually, slowly introduce things to the child. Years ago, one of my good friends and colleagues, Dr. Bruce Golden, showed me his puppet. And we like to use a little puppet following his lead. We show the child how we count teeth. We put the puppet in the chair. We have the puppet put on sunglasses to show how it's going to protect their eyes. And we gradually, slowly introduce everything to the child. We make the transfer from the parent's lap into the dental chair, and we encourage the parent to come up close if they'd like and hold on to the child's foot. But we stress that it's important that the parent not talk to the child, so that the child and the dentist, my staff, that we can interact. And however helpful the parents may be, sometimes it can break that flow. And then we use a technique that all pediatric dentists use, and that's something called tell, show, do. And it's as simple as it sounds. First, we tell in simple language what we are going to do. We show the child what we're going to do. Typically, we'll demonstrate first on my finger, then on the child's finger. We have the child hold a hand mirror, and we demonstrate finally on the child's tooth. And we go through every single instrument in the office that way. There's nothing that I use in the office that I don't use that I don't show the child first, have, hold, watch, and try themselves in most cases. And then you finally do. You've got to get in there and you've got to plow ahead. And by going slowly like that, most children will be very comfortable. Also, I want to say how important it is to have a good staff. My staff has been with me for many, many years, and they know how we like to work. They get right in there. They're helpful and friendly to the child. They use the right language, the appropriate language. They follow a slow, comfortable pace. So many times I think people think pediatric dentists are magicians and that we can get kids to behave and do sometimes some difficult treatment, whereas in other situations the child won't even come into the room. And it's because we do it slowly and we pay very, very close attention to detail. There's very little that we do that we haven't thought out and made a plan for.
I was very impressed with the openness of the office, and also there's an area for siblings, and it's very easy for a parent to be there. So it was a very child-friendly office. Let's go on and talk a little bit about fluoride and how it's impacted dentistry. We did mention before about the toothpaste being fluorinated.
Exactly. The most important way to get fluoride is to swallow it. In most of lower Westchester County, it's in the water. It's been here for years. New York City water supply also. But there are some areas that don't, and it's important that you check with your own water company to see if there is fluoride in the water. If there's not, then your pediatric dentist or your pediatrician needs to give a prescription for fluoride starting at 6 months old. Okay. We kind of take it for granted because it's been in the water so long, but it's had a tremendous impact on the dental health of America. Consistently using fluoride with mother during her pregnancy and then throughout early childhood into the early teen years reduces cavities 60 to 70% in a person's lifetime. It is just a tremendous reduction in decay. So it's so important that you do get it. The other thing that's important for people to consider is that it is not in most bottled waters.
That was my next question to you, bottled water. Yeah.
Yeah, there are a few people, if they look in the grocery store now with a careful eye, they'll see there are a few brands that are starting to advertise on the label that, yes, we do have fluoride in this bottled water. Most bottled water does not. And the common water filters, the easy ones that attach to the tap or you put into a pitcher, that style, they do not take the fluoride out. Some of the more complicated, the sink versions, the plumber-installed ones in the basement, many of those take the fluoride out. So it's important to check with your water filter company if you have one of the more complicated ones to see if the fluoride's being removed.
Okay, let's talk a little bit about sealants and how do you use them and when you use them.
Sealants are a wonderful preventive tool. They've been used since the mid-70s. They've been widely used since the early and mid-80s. It's a thin, hard plastic coating that's applied to the top of the tooth that helps prevent bacteria and food from getting down in the crevices. In the picture on the left, you can see a typical permanent molar with deep natural crevices. That tooth does not have decay. It's just stained. And the tooth in the far right has the sealant applied to it. Covers the chewing surface and a little bit down the sides of the tooth. It's a simple process. The tooth is cleaned, rinsed. We paint it with a little solution, rinse that off. We apply the coating to the top of the tooth. We harden it in about 20 seconds. It bonds to the tooth, and it makes a very effective mechanical barrier. It's a wonderful decay preventer. There are two limitations that we tell parents. Number one, it does not prevent decay in between the teeth, so you still have to floss.
Okay.
Number two, they do wear down with because it is on the chewing surface. We can't build it up too thick or it interferes with the bite.
Right.
So after a number of years, they do wear down and they can be reapplied if necessary to reinforce them.
Now, I know we only have a few minutes left, but could you quickly just demonstrate, because I did promise, how to brush your child's teeth?
Sure. Again, you want to use a soft toothbrush. A good way to do it is to angle the toothbrush at a 45-degree angle so that some of those bristles are getting just under the gum line, and then a gentle back and forth motion. Not a hard scrubbing motion, but a gentle back and forth motion on baby teeth. 2 to 3 teeth at a time is usually fine, and then you can whisk away whatever bacteria you've loosened. You need to do the outside, the inside, and the chewing surface as well. And then finally, got to use that floss because on this model, the teeth are tight together. You want to fit it in gently. Don't snap it in, but gradually pass it through. Pull it against the side of the tooth, remembering bacteria don't stick to the gums, they stick to the teeth. And you want to gently, sort of shoe shine style, rub the bacteria off and then pull it against the adjacent tooth and back and forth against that tooth. And you do that thoroughly once a day and you'll do the trick.
Now, we do have an email question that was emailed to our website, and the question was, my son sucks his thumb. Is this bad for his teeth? What do you say to that?
Well, it's usually not helpful. If a child can stop that habit by 2 or 3, usually nature will take over. The lip muscles are strong enough that they'll pull the teeth back into proper position. As it goes on, it can cause more damage because it starts to actually shape the bone as well as push on the teeth. Gentle reminders and gentle helpful reminders from the dentist through the early childhood years gets most kids to stop. As they get a little older and they can intellectualize about it, then there's some other things that we can do to suggest to kids and some appliances that we can make in older children to help discourage the habit.
Now, we have about a minute left, so why don't you outline for parents some of the general things they can do to keep their children's teeth healthy?
First, in infants, be sure you don't give them that nursing bottle in bed. Second, be sure to clean your children's teeth, supervise the brushing. Third, limit their sweets. Make sure that they understand it's dessert food, it's not snack food. And stress to them by good example how important overall nutrition is. Not only is it helpful for building healthy body, but also healthy teeth.
Now, when your child is young and teething, is there anything special for parents for that age group of child?
There's no magic formula. Generally, what most parents know is the best they can do. Gentle massaging, those hard toys cool toys to suck on. When it's very bad, occasionally you can apply a little of the topical anesthetic with a Q-tip.
Okay, thank you. I think we've run out of time. Thank you, Dr. Smith.
You're welcome.
For more information about dental care in your child, speak with your healthcare provider. If you have either a question that you would like answered during a future health talk or a topic suggestion, please email us at healthtalk@sshsw.org. Join us next week and every week at this time when Sound Shore Medical Center presents health information for your good health.